So remember, upcoming ones again today. We're doing the second part with Shannon. It should be fabulous. I do actually have an interesting sheet of paper that I had a little problem with that this morning. So we have time for questions as well. Remember, during the holidays, we're just not going to do much. We're going to pretty much just eat and eat again. I
don't know.
So
I have a lot of children I get to entertain.
Yeah, I don't. And so on Wednesday, again, remember, right after the first of the year, we have our friend Sanjeev coming to talk about hepatitis C. Should be fabulous. And we have a number of other talks we're going to be putting into January. So we'll get those next time when we get going. So remember, there's free CME. Just make sure you fill out the forms. Remember, if there's more than one person in the room, please let us know. And gosh, if you could turn on your videos, we like to think we're the Echo that has the most videos on in the entire world. Remember, we're always there for you. If you need anything, please call us. Again, Erin is on there as well. You can give her a call or give us a call, and we're happy to help you if you've got a little bit of an issue where you're at with the patient. Nothing else. We don't do counseling or anything.
Definitely you don't do that.
Yeah, I don't do that. So again, remember that the Center for Opioid Resources, the CORE, that has all of the different information that we've developed over time. So feel free to check that out. I'm doing this as fast as possible.
You're doing a great job.
We actually had two different podcasts come off this week, both on Gambling 1 and Gambling 2, based on one of the talks that was given. We took some of that information, put it on there. Again, about 120 different topics on there. So feel free to check that out. And that was Ted that gave the gambling talk. So move to the next one.
Oh, we got to take those down and we'll turn it over to Shannon.
Then we'll turn it to Shannon.
Hello.
Hello, how are you?
I'm good. Happy holidays, everybody.
Yeah, you too. This must be why I'm like having the biggest difficulty ever opening any type of pictures.
She got this new computer. It's been pretty dicey since then.
It's been fun. So
you got a new computer. Okay. Well, it might be partially my fault because I did not send any slides. So maybe that was why. Because I'm here pretty much today to just answer questions after the talk that I gave a couple weeks ago. But I thought before I answer any questions or assist anybody any way I can, I would just log into our test account and give you a quick just guide through an online PMP account. And I know that a majority of the searching that is done in Minnesota today is done through an EHR or a pharmacy dispensing software system. However, there are still instances where you do have to go into the online web account, which is called Aware. And at a minimum, you have to go in and update your profile once a year, update your profile once a year. And there's also some pretty good resources in there. So it's worth going through and just knowing what's available to you. So I'm going to go ahead and do a demonstration. Can you see my screen?
Yep, we sure can.
Okay. So this is the homepage where the system is set. I mean, your system may be set within your healthcare entity not to remember email and password, but we don't have that as a hard stop with the PMP. So you can, it is capable of remembering an email and password. I know it's not always the best thing to do when you're working in clinics with shared workstations, but if it doesn't do it, it's not because it's stopped by us. So, and on the login screen, you can also see that there's an option to reset password. So if you don't know your password to access your account, you don't need to fill in any of this information. You can just leave it blank and then go to reset password. And all you need to know is the email address that you last accessed your account as your username with, and enter that here and hit continue. It'll send you a link to that email account to reset and create a new password. If you no longer have access to that old email account, which happens sometimes if people change jobs and they don't access it for quite some time, you do need to contact our program we just verify a few things and then we will change your email address for you. We do need to do a couple items of verification because changing your email is like handing out your username and the ability to create a password. So there's a little bit of, yeah, we ask you to provide your date of birth and the last 4 of your social, which we reference from the board. We have an internal secure file for that. And we're the only ones that can see that. Our vendor can't even access your last 4 of your social. So it's very secure, and that's the only reason we
can. I say one thing, Shannon, because after those of you who heard me heard that I had not the ability to log in because of that exact same reason. Apparently, I registered my cell phone number as well with it. And so I was able to reset my password and my email because I was able to get the link sent to my cell phone.
Yep, that was the next point. If you have added your mobile phone number, which is completely optional, and I can also say that the PMP will never reach out and contact you by your cell phone number. We really don't use the phone to contact anybody. We rarely contact anybody unless there's an issue with a potential breach or something. But you can put your mobile phone number in there. And in that case, you would just enter your old email address, even if you no longer have access to it, hit continue, and you have the option to send yourself a text code to create a new password. And people that rarely access their online account, I highly recommend this because you don't ever even have to remember your password. If you're going in twice a year to update your profile and use a couple of resources, and you have your mobile phone number in your pocket all the time, just create a new password every time. It takes 2 minutes. So that is one point. And then I'm just going to go back to the login screen. Also, if anybody does not have an account, you can click here and create a new account. Logging in. My email is minnesotaprogram at minnesota.state.com. So the first landing page for every provider is going to be the My Dashboard. And this just lists a few items that most people would, we want to bring to their attention right away. I had spoken a couple weeks ago about our new patient alerts that will appear in the PMP account. You'll also receive a email once per month with a list of patient alerts that are attributed to your patients that you've prescribed for. You can log into your account and you'll see a list of them here. This one I've already looked at, but if I hadn't, you'll see a little new icon next to it. If you click on the patient's name, it'll create a new PMP report for the patient, and the patient alert will be visible on that report. If you just want to see what type of alert it was without viewing the actual report, you can go to view all patient alerts and you'll get a list of all of them with the alert type here. Again, you can click on the name and it will create an account or a PMP history report as of today, and it will generate the alert if the alert is still active. This patient had an alert that generated based on an opiate and benzo overlap, and that overlap no longer exists. So the alert has been removed. We're actually working on that to keep that, put some sort of notification in there regarding the alert date was 11/11, so that's been out of there for that amount of time, but we'd like to have somewhere where you can still see those. They're a new feature, so it's still a work in progress. And then recent requests. This is just a list of the requests that you've performed most recently in chronological order from today backwards. Also, it will include any searches performed by your delegates on your behalf. The delegate name will be listed here. You can view request history to have a full list of the last 120 days, or click on the patient's name to either see the report as it was run on this date at that time, or you also have the option to create a new report. This is your area for delegates. If you have approved any delegates that work with you to access the information on your behalf, their information will be here. And then the status, you can click on any of the delegates and you'll go to delegate management and you can see their status. If you highlight any of the lines, it'll bring up an information card below and you can take action depending on what the current status is. This status of my delegate named delegate demo is pending. So I have not approved them. They cannot access data on my behalf, but I can click approve, or I can reject to permanently remove them from my list. Approved, the options are to permanently remove them from my list. When it is, if you are utilizing delegates, after the quarter, the first day after the end of a quarter, you will get a notification that's a banner in your account that tells you that it's now an auditing period for your delegates. Now, if any one of these 4 delegates did not perform any searches in the previous quarter, you will have no action to take, and there will be no icons indicating that you have anything to review. If delegate demo 2 was the only one that had performed searches, it will say action required, and you'll have a icon to click. And a brief history of the searches that were performed. It just includes the patient first name, last name, date of birth, and the date of the search. And it'll generate in a list, so you can quickly review it and just make sure that these are familiar patients to you to ensure that they're searching compliantly. Once that review is done, you attest to it, and your audit is complete. You also get an email at the beginning of that auditing period at the end of the quarter reminding you to do so. Let's see, we'll go back to the dashboard. That's pretty much delegate access. And then on my favorites, it's just a quick link to do a patient search or to reset your password if you want to create a new one. This is an advertisement just talking about what we talked about previously, which is the ability to integrate access into your EHR. And this is a link to just get more information for anybody who is performing all their searches within the web-based portal. They can click here and get information on how to get that into their EHR. Any PMP announcements, including requirement that the delegate audit is now open, will be here. New ones that have not been read will have the new indicator, of course. And then quick links down here, we talked about a little bit. Fast Tracker, I'm not sure if anybody's familiar with it. It's not provided by us, but it is Minnesota-based, where you can access recovery resources in the state, and they are required to participate in this. They are required to keep it up to date as far as open beds. And our PMP home, a Minnesota naloxone locator called Know the Dangers, and this is the reference guide for a prescriber report that you would get sent quarterly. And we talked about the prescriber report a little bit. This is the reference guide that you'll also get a link in your email. And just looking at a couple of the resources that are within here, in the tab under RX search, of course, there's an option for performing a patient request. Request history is a place that you can go to see a detail of all the searches that were performed by you in the last 120 days, as well as your delegates. This is the page that you would go to if you're performing a delegate audit and you want to do some advanced filtering options, like look just for one delegate. You can look, Susie Q as the requester name, and then a date span, and it'll show up just all of the searches performed by your delegate named Susie Q. Let's see. MyRx is another tool that I don't think I talked about last time, but this will pull up a history of the last 12 months of prescriptions that have been reported to our PMP in Minnesota, attributed to the DEA number or numbers that are associated with your Minnesota PMP account. You can restrict that to less than a year if you'd like, and then you can, if you have more than one DEA number, you can choose multiple or just one. And you can also filter by generic drug name, which you do not need to. But just selecting a DEA number and a date span, and then you can click search. I'm not going to search this because it's actually going to show data, because in our test account, there are pharmacies that actually report under using this DEA number. So
Shannon, could you give like an example of why I'd want to do this?
If there was information that there was individuals in your community that were using people's DEA numbers without their permission, if you had an employee that was dismissed from your practice and had for some drug offenses that you had some suspicion that your DEA might have been compromised, Also, when you get your PMP prescriber report, you can really drill down and see data about your patients and who's picked up what without performing an individual patient search.
Okay.
Which individual patient searches are, it's governed in statute when you can search for a patient, but you can look at your own prescribing according to your DEA within this tool. So it's a little bit more freedom for you to look at your information. We recommend taking a look quarterly just to make sure that you recognize the names that are in there. And if not for any other reason, that human beings are entering the information at these pharmacies, and we will give them a call. Either you can, or we will give them a call on your behalf to correct information if you see that it's wrong.
Can you just give us an idea of how often people have, where this has become an issue, where somebody's using a DEA? Is that something you see with some frequency?
Somewhat, yes.
Okay.
I won't say it's part of our daily practices because we can't really assist in it. We don't investigate it. But we refer people to this tool if they have suspicion. Because it's not the PMPR program doesn't have the authority to harvest look through the information and look at the database to identify things of this nature. But if there is suspicion, we can we let the pharmacy know to contact the provider and have them do a search. The pharmacies don't have the access to use the PMP to look at all of their dispensing data this way. They would have to use their own resources. So it's a quick way to identify information.
Perfect. Thank you.
It was actually used a lot more before the prescriber reports. The prescriber reports arrive quarterly. Unfortunately, the view rate of those is really low for how much great information they give people. Now they're interactive. So when you look at the number of patients that you prescribe to in each category in comparison to your peers, you can click on each part of the bar graph, and it produces a list of the patients, the dates, the prescription, where it used to be where we would have to go, we would recommend that you go in and run a MyRx history. So, but it's still here, and there are some people that run it regularly and just for their own records. You can only extract a report by PDF. So we know that some entities would like to have providers extract it by CSV and just store a whole database of their own, but that's not something that's possible. So you can extract a PDF of your own.
Yeah. And one other question, how often and what should we do if we look in there and we have a delegate and they're inappropriately looking at things? Where do we go with that? Who do we talk to?
Yep. If you do, the first thing to do would be just to remove their access. You don't have to remove them immediately. Statute requires that you notify the PMP within 7 days. And there is Q&A or frequently asked questions on our website about delegate access and impermissible use. We ask that you notify us. And at that point, we usually recommend a couple things. If it's most of the time when we have heard this, it's that a delegate is searching all the patients in the clinic under one provider, which is not permissible. But it usually is just, we recommend that they educate the delegate and then check again every 30 days. And if they're not, if they're not correcting their behavior, then we have to take it from there and probably remove their access. And it's usually something that's more handled at the clinic because they're not, reacting to corrective action. But it's almost every time it's able to be corrected with education.
So
I have on a couple examples, they've wanted additional education, and I have met one-on-one with a few people and provided some pretty straightforward statute education regarding permissible use.
So this is one thing that we ran into when we first started. All of our teaching programs are now called TOWNS programs, because the controlled substance care team nurses would pull everybody's PMP for all the doctors every day. Or, as they were doing all the refills for the whole clinic on controlled substances, it would just kind of be under, typically it was Kurt's name, or my name. So then it was easier for the nurse then to have to log out and log in and change to each individual doctor. And so that was an issue we noticed right away. And so there's a few of the nurses on here that have had to, it's more work for them, but they've had to adjust that for that reason.
One thing that we have tried advocating for, and we haven't gotten anywhere yet, but we've heard the information, the request from our Minnesota community, is that to look for a supervisor or a regular non-delegate role for an RN, and it would be just for that medication refills, because they're searching the database and they're not acting as a delegate. They're making decisions. They're evaluating the PMP data. They're not creating the report and handing it to the prescriber, but they're evaluating the PMP data based on established criteria that were created by the prescribers or pharmacists. So it's really a unique role, and Minnesota doesn't have a fit for it. They can certainly log in as a delegate, but they don't necessarily have to log out to pick another doctor. They just need to pick another doctor from the drop down. But ideally, we'd like to be able to get them gateway access, integrated access, so they can do that one-click search through the report, and right now, or through the EHR, and right now they can't, because delegates cannot access it that way. We've been historically trying to eliminate delegates evaluating the data and telling the provider, oh, they're good, oh, they're bad. So that's the reason why. But that's a work in progress as well. Okay, and then if I can interrupt me at any time if anybody has questions. The prescriber report tab, this is where you're going to find prescriber reports that you've gotten in the past. I hope I didn't get logged out. Yep, so you can click on, if you have more than one DEA, of course, you're going to have more than one prescriber report. I don't think I have a prescriber report for this provider, so this is going to generate one. And if you did not prescribe anything that was reported to the PMP in the previous 6-month period, this is what your prescriber report is going to look like. And there's a drop down to choose different quarters and view that. I'm not going to drop down because I'm probably eventually going to find something. And patient alerts, this is just, again, that main page that you can link to from the dashboard that we already looked at regarding patient alerts. One other thing that I want to look at is my profile. You can click on menu and go to my profile, or you can also access it through your name is going to be up here in the right-hand corner, and you can go to my profile. You can also access delegate management and password reset, which we already looked at up here as well. This is where you can go and look at what information you have in your account right now. Credential items cannot be edited by the user because you have to contact our program so that we can verify your credentials belong to you before we add them. When we add this information to your account, it gives you visibility to a lot of information. But you can edit your employer address, your employer, which is your primary work location. And if you can enter your edit your employer phone number. And this is where you would change or add a specialty. And now your primary specialty is indicated with the purple star. You can list multiple specialties if you like. And when we were talking about that prescriber report, when it's a peer comparison, this is the level 2 comparison that they're using for that, that peer comparison. This considers all physicians, allopathic, osteopathic physicians. And then the second level is dermatology. Now, looking down at dental providers, this is a group of dental providers. The second level is dentist. And then there's a third level, which is dental public health. Now, if there's not enough account holders for a valid comparison in dental public health, they're going to group them by the second level, which is dentist, if that makes sense. Let's see. And there's tons to choose from. Time zone usually stays the same. This is where you can add or update your mobile phone number and add or excuse me, edit your email address, which is also your username. Once you edit this, that is your login from then that moment forward. And then just the last thing I had mentioned were some training links. This is NARCS Care Overview, which will talk about just a little bit of education on the NARCS Care report itself, which is the interactive graphs, the risk scores, NARCS scores. This is additional information about those NARCS scores, which are risk scores, overdose risk score, which is the individual score. They're a little overwhelming to look at if you don't understand how they're generated. And then this is the main user guide, which is also available on our website. It's about 60 pages, but it has a really great table of contents that's made with hyperlinks. So you can open it up, find the category you need, and click right to it. It's really user-friendly. And just the links again from the homepage.
Couple of questions.
Yeah.
You know, it seemed like in the old days being maybe 10 years ago, patients could sometimes have accounts at different pharmacies and have a different birth date on file at each of them by a day or two. Is something like that still possible when in a system like this? When we're
it is. However, the patient matching algorithms that we have in our new AWARE system are exceptionally better than in the previous system. When we were doing searches as administrators, when I say searches as administrators, we fulfill searches for search warrants and health boards. So we're doing searches just like you do. In this previous system, it was very, very common every day to perform a search and get a result of, 6 to 10 results that we would have to go through and look at and select the ones that we believed fit the criteria and then generate the report. It is very rare if I get a choice between two records to choose from that haven't already been joined together by the patient matching algorithms. Of course, there are some false groupings. And if you do, I'm just going to show you, I'm going to pull up this report to give you an idea of what I mean when I say false groupings. Well, this isn't a really great example, but at the beginning of the report, you're going to see the patient that you searched for, their date of birth, their address, and this is going to be the most recent address attached to the address reported by the pharmacy that dispensed the most recent prescription. Now, this person has only one linked record. So the prescriptions in the last 12 months, which make up this report, are all dispensed under the same record, which means the same pharmacy. It doesn't mean that pharmacies one pharmacy doesn't sometimes report one patient with separate records. But viewing the linked records, and we have it defaulted so that they're all going to display when you open the report, you're going to see multiple names or linked records right at the top. So this is ID number 1. You can see sometimes up to 7, and you can see the details of where the address is, what the date of birth is. If they're similar dates of birth and not exactly, most likely they would have to be manually consolidated by us, but it would have been done a long time ago at this point. And then moving down, when you are looking at this ID number, when you come down, sorry, I'm scrolling kind of fast, but when you look at the records, you can see ID number here. So this was dispensed to patient ID number 1. This was patient ID number 1. And then you can see each pharmacy that's related to each record, each prescriber that's related to each record. It helps you, and you can sort that way too. So if there's more than one patient, you can sort them from highest to lowest, lowest to highest. So you can really get a good idea of who the patient is, where they went, and what pharmacy is dispensing it under what information. Does that make sense?
Yes.
We actually have a queue that we work every day of if you do perform a search and you have more than one patient that comes up for you to select and you decide to join those two together to make one report, you have the option of submitting a request to our program to have those reports reviewed for linking. And we work that queue every day. And so we manually review them. Sometimes we can't link them because the names are identical or the names are too common to link. And we have to say, it's just going to have to be manually linked every time because we can't identify that this could. But most of the time, if we're getting it from you and they look the same, we link them.
All right. I have a quick question about the delegate thing. So for instance, my nurse queues up a refill request for, Suboxone, and she sends the refill to me to then, sign, and has the information, PMP access, last refill, has all that information in there. I go to refill it. I still have to go into the PMP through my EMR to click approve. You know what I mean? Like it doesn't just automatically, even if she's logged in with me as her, under my delegate or whatever you want to call it. We still then have to go into the PMP and click the button in the EMR. Is that an EMR thing or is that just how it is because I'm the one officially finalizing it?
That's definitely set up by your EMR. And they can be set up differently by every different entity in the state. My question is, do you need that nurse to review it when you're reviewing it anyways?
Well, and that's part of the question. I'm guessing she does because it's easier for Kurt then to know when it was last refilled.
Yeah.
Because and it is nice, like to be honest, when Brittany, for instance, who's on here, like she'll review it. Do I review it in detail then? If she states in her note or in the message that comes to me, PMP reviewed last refill, will I click on the PMP tab and hit approve? Yes. Do I read it? No, because she just did. And so I think workflow wise, at least for me and probably for Kurt, it's just way faster if she does, but it makes more work for her. So I guess that's kind of the debate.
But it's a system. It's our system that's doing that to us.
Right. That was my question is it that? Is it?
Yeah, it's definitely a system that's forcing that. But I would say, I know you're looking to speed up the process, but I'm wondering if, well, I'm sure that you have your delegates trained to look for what you want them to look for, but I don't think it's intended really. I think we are trying to provide a lot of information that can be seen at a quick glance. And I know that there's a lot of providers that are just looking for one thing, and that's the last refill date.
Right.
But we invest a lot to try and provide more than that, like more of a whole picture. But I know you guys are.
Well, I think a lot of it varies on like how busy, like I'll scroll down usually
and how well you know the patient. There's a lot of factors. I know.
I scroll down and I just see a bunch of Suboxone refills. Then it's quick because they all look, like you can see the words all line up. They all look the same. And if there's like a gabapentin on there or a benzo or not, something else, that will catch my eye. But
yeah,
it's just.
And I think more so if we were doing opioids, which we don't do for the most part, that would mean I would probably look at more things.
Our nurse just commented, Shannon, she'll note any early refills, fills of other controlled substances that are newer routine. So she does all that for us.
Yeah. So we got to talk to our Epic people.
We're spoiled.
Yeah. Okay.
Do you guys use the graphs? There's a buprenorphine graph that you should be able to see, like a solid line. You should be able to see breaks in prescriptions. You should be able to see overlaps with multiple prescribers, any instances of like a narcotic popping up. Other is usually like gabapentin.
I don't think that shows up on the one that runs through Epic because unless I just have not noticed.
It
Is
should.
the block thing
Pardon?
that shows up horizontally depending on the drug.
Mhm.
Okay.
Is that, I'm just asking if that's
Like,
if they have a couple different things, like if they have, if they have only buprenorphine, that'll show up as a horizontal block over time, it looks like.
yes.
It shows up on there.
Yep. It'll be the way that it shows up. And again, I'm not picking good reports to show you, but there'll be a different color for each. Like this is a combination of red and blue. So it's coming up as purple because there's a Xanax and an oxycodone that overlapped.
Okay.
If that makes sense.
Okay.
So it's just kind of a shade of purple, but, and you can click on it just to see you can click on it at any time. Like a pixel is a day. So, I mean, it would give you a pretty good idea really quickly of what's been prescribed in the last, week. And then there is a buprenorphine graph that goes like this, but it doesn't combine everything together. Like, I mean, I think the color-coded graphs are a good way to look for breaks in prescribing or overlaps, things like that, and especially overlapping prescribers as well. But there is a.
That is interesting. So I just opened up. I have mine open and I just opened up a patient and it is interesting where it says all prescribers because she has a prescriber for a benzo and then I'm doing her buprenorphine where it says all prescribers. It actually shows a shaded that there's overlap there.
Mm-hmm. So. Yeah, and then breaks a lot of times because we had talked about this previously and I should answer this question out loud that we do not receive any dispensations that patients receive while they're incarcerated. So those are considered inpatient administered drugs. If they're taking them home with them, then those are required to be reported. So we kind of educate that if you see breaks in these, especially in the color-coded graphs, that could be indicative of like a hospitalization or incarceration that you might not be aware of.
Oh, sure.
So this is kind of the question portion, I hope. But here's the other question I have, and I think a lot of people have probably gotten this, where I've gotten a couple of alerts, and I would say it is extremely uncommon that I'm prescribing any opioid or any benzo. Very rare. Although my patients often are getting some things, especially benzos, from somebody else. When you get that alert email, it doesn't seem like there's a spot on there that you can just go right to the website. You have to actually go out and then log in separately, correct? There's no links associated with those emails.
I have to look at our demos of those, but I apologize. I remember you saying that last time, and I was going to take that back as feedback to a link from the notification email that's received once a month to easily log into your PMP account.
Correct, and that's what I'm wondering.
Go right into the actual alert.
Yeah, because I looked.
That's not possible. That's not going to be possible. Yeah. I'm
just wondering, would it be a reasonable thing for you guys to have that link so we just do it? Because if you give me 10 minutes to think about it and get to it later, I don't get to it. Right. Mm-hmm. I mean, it's that thing. If I don't do it right now, I probably, and I think there's maybe other people like me on this call, if I have the opportunity to do it right at that second, I'll probably do it.
I think if we can the one thing is if we can get you to log into your PMP account, it will be right there and they'll all be there. The history of all of them that you've received with description. But it's just, we can't have anything link right to a report because then we would have to be on a whole nother level of security in those emails.
So maybe even just the
link to the
link just to the PDMP
to log in. Yeah, because you're not used to logging into the web-based portal.
Correct. Yeah.
I think the alert that drives me the most crazy now that I have access to my PMP for a whole hot couple of weeks is the overlap, the opioid, sedative benzo overlap, because, I don't prescribe many benzos with my buprenorphine, but I have a lot of patients that are getting them from psych, and I get all of those alerts. Even though I'm not prescribing. And I totally understand the reasoning is that I should be alerted to somebody else is getting these, but that's also on the PDMP to see it. But those are the alerts that drive me crazy.
Well, we definitely want to prevent alert fatigue. But on the other side of that alert in the report is critical for that other provider that's providing those sedatives.
Right.
Because they need to know that, even though you're aware of what you're doing, it may be more critical for them to know. And we pushed, we had an additional, I think, 12 months to push these out, because we were insistent that you get one email a month, no matter how many alerts you get. So the system was defaulted to send an email every time you triggered an alert. So if there was an overlap for every patient every day, you would get that many emails every day, which our goal is to send meaningful communications. So we just, the intent of the alert is to make you aware if you are otherwise not aware. If you are aware, just disregard, apologize.
No, I think it's good. I think you're right. I think it's helpful for both sides to see it. And yeah.
So just today, I got this sheet of paper that I printed, and I actually was doing a PDMP on somebody I've done a PDMP on before, and I've seen as a patient off and on for years, and it would not allow it. It said it disallowed. Patient, based on the patient details submitted, your state PMP could not identify a unique patient, so it wants me to manually do it. What can change that can all of a sudden do that? Is there any thought?
Well, yeah, there is. It's because there's probably not, you can email that to me actually, because what it is there's a pick list that was generated for the patients, which means another account was somebody reported a prescription using a derivation in the demographics, and the records have not yet been linked together.
Okay.
So through the gateway, they don't want to provide you a partial report when there potentially could be a complete report. However, if you do log into your account and create that report and identify that those two accounts belong to the same individual, again, you'll have the opportunity to send a flag to us to combine those, and it won't happen again.
Okay.
So with that, and maybe I just didn't understand it the first time. So if I log in, do that, will I get an alert and have the ability to personally link that or to personally approve that? Like it'll show up like, hey, there's two people. Do you want to review them both? Or
yes, you can create a report with both people. The reports will be side by side though. It's actually one above the other, which definitely makes it a little bit more difficult to assess because you're putting them together in your mind. But if you let us know right away, we'll put them together right away. And then you can generate a report in 5 minutes that they're together.
Okay.
And we love those. We love those requests because those are things that we can control and make life really easy really quickly.
All right.
That is interesting because you've logged into that person before.
Correct.
Send us the information.
Yeah,
Miranda's waiting for you.
Yeah, I'll, I may have to have Brittany kind of look at this as well. All right.
Kidding. Are there other questions? Because I think this, from what I have, obviously we've had you on years ago as well, Shannon, is this continues to just evolve with a lot of, like you said, meaningful, positive information, which unless you're staring at it every day, sometimes can look overwhelming, yet you just have to look at it, which is what you obviously are doing for us today. So are there other questions from other people? Because for me, I hadn't logged into it for over a year, and this was a little bit more overwhelming to me recently than it was back then. Plus, your color scheme is way better than it used to be.
Yeah.
Oh my gosh. I started with the PMP when it was the old one. And I'm like, I came from Epic to the old PMP. And I'm like, are you kidding me? I'm like, we need to get this moving. But yeah, I really like I mean, we've heard really positive things about the functionality of the Aware system, and our vendor is pretty supportive about, customizing things to the way we want it. It usually takes a little bit of time, but we work at it. So let us know what you want, what you need.
All right. Any other questions, or we may actually end a little bit early today?
So everyone can drive safely in the blizzard and finish Christmas present wrapping shopping.
All right. Being none, we'll thank you, Shannon, for coming back a last time, and maybe in another year and a half, we'll get you back and find out what's new.
Once you've actually overlapped with the state report card prescribing.
Yeah.
Oh,
Your patient alert, your patient report things, or your provider report.
yep.
So much like the report card paper. It just seems so goofy to me, but.
I know. We found out about those launching right before ours launched, but we do have open lines of communication with the program that's doing those. So we try not to launch at the same time. We try to make sure our communications are clear.
All right.
Everybody else, let us know if you have questions.
All right.
Thank you.
Thanks so much.